we have a lot of arteries to cover today, as you can see. Don't worry, we're not going to be covering all of these. We are just going to be covering the axillary artery, which is highlighted, the brachial artery, and then we will go into some of the structures of the radial and ulnar arteries. Now, we're not going to cover every single collateral and recurrent, but we're going to cover most of the arteries of the arm. We'll cover some of these vessels when we cover the heart. Don't worry. I know you're concerned. So we're going to start with the axillary. So axillary artery switches names from subclavian artery. It's the same structure. You can see it's the same tube, right? It switches from subclavian to axillary right around the second rib. So you can see the second rib here. And if it's out from underneath the clavicle, you know you're on axillary artery. That can be a little confusing. If I were going to tag it, it'd be mean, but I said, okay, what's that artery right there? And you'd be like, oh boy, I don't know if that's subclavian or axillary, because on a quiz it won't be highlighted like this, right? So one thing you can do to make sure is remember that this structure right here, which is called superior thoracic artery, I've always learned it as highest thoracic artery, but that's okay. Either are acceptable. This structure comes off of the axillary artery. So if I tag, even if I tag it right here, well, that's still distal to this structure. So we know it's axillary because this comes off the axillary. So the division's right about there. So if I tag the axillary artery, I will make sure to do so distal of this structure. I'll actually try to be much nicer and tag it like right there, but you get the idea. This is the axillary artery. It's named for its location in the axilla, or the armpit. So we're going to name the 6 or so structures that come off of this artery. It has a little mnemonic device. Some of you may have heard it already. It's hotel, spa. A weird mnemonic, but it works. And so is mnemonic device occur? Yeah, this is a mnemonic. So the first artery starts with an H, highest thoracic. The second is thoracoacromial trunk. The third is lateral thoracic. Subscapular, posterior humeral circumflex, and anterior humeral circumflex. So that's what we're going to cover. So jot that down. Hotel, spa, the O and the E don't do anything. Let's take a look. So the H, highest thoracic, is this guy right here. Now they've labeled it superior thoracic artery. Again, that's okay. Different names for the same thing. Highest thoracic artery. That's the H. Now I need the T. The T is thoracoacromial trunk. So it's called a trunk because it has a lot of branches. So if you're looking here, we see a bunch of arteries. One of them in particular is a trunk with branches coming off of it. That's a thoracoacromial trunk. There are so many different variations of how to say this. They say thoracoacromial artery trunk. Some places say thoracoacromial artery. I learned it as thoracoacromial trunk artery. Any version of that is acceptable. Okay. Anyway, so it's thoraco because it has some branches going towards the thorax and some branches going towards the acromion. It has its own branches, and the mnemonic for that is all dogs can pee, and it's A, D, C, P. So we have 4 branches. All dogs can pee: acromial, deltoid, clavicular, and pectoral. Let's see if we can find those. I'm doing this for the first time as well on this model, so we're learning together. I suspect, see, this one looks like it's going maybe acromial, maybe deltoid too, but this is so big it looks like deltoid, and it is. Okay, so good. I bet this is acromial, and it is. The acromial branch of the thoracoacromial trunk. The deltoid branch of the thoracoacromial trunk. This looks clavicular, and clavicular usually is tiny, so that makes sense. Yep, clavicular branch of thoracoacromial trunk. And the biggest one, typically, is the pectoral branch of the thoracoacromial trunk. What's cool about this is that we can guess it without even clicking. That was the very first time I've clicked on it, and I can guess it based on the direction. So, I mean, remember, This is the acromion. Your deltoids are over here. Your pecs are over there. And what's left? Oh, and your clavicle's right here. So it makes sense then that this structure is acromial. So it has a few branches, right? This structure is deltoid. This is pectoral. And this is clavicular. It just makes sense based on the directions. So those are all fair game. This could be a quiz question like this. Boom. What is that artery? And you would say that is the acromial branch of the thoracoacromial trunk artery, if you want. That's a lot of words, and I apologize, but I know you guys can do it. So that is T in our hotel spa. So H was highest thoracic. T is thoracoacromial trunk artery. And then it has 4 branches that we just talked about. So now we're looking for L. L goes along the side of the rib cage. It's called lateral thoracic. It's an artery. It's actually right next to long thoracic nerve, which is not that. Oh, here it is. Long thoracic nerve. So do we see an artery running parallel to long thoracic nerve? We do. Lateral thoracic artery. And it comes off right after thoracoacromial trunk. The hotel spa is in order. So again, H, T, L. Lateral thoracic artery. HTL. No branches. So now we need to get to the spa, the hotel spa. This gets a little trickier. I don't want to teach it entirely from a posterior view, but it is kind of helpful. So check this out. Do you guys see this loop around the surgical neck of the humerus? That's going to be important later. That's actually not what we're looking for right now. They've drawn it a little out of order. It looks like they've drawn the S right there. And S is, to be honest with you, I've looked at 100, probably more cadavers, and it's not always SPA in that order. A lot of times they all come off almost the exact same spot. I've never seen P and A this far apart, by the way. I know we haven't gotten there yet, but that is typically not how it looks. But it's okay. All cadavers are different. Doesn't mean it's wrong. You have to go off more than just, black and white rules. It's more what do they look like? Where is it traveling? That kind of thing. But anyway, our next artery is S, and that's subscapular artery. And there it is. Now, typically in a cadaver, this is a very noticeable artery. It's very large, very, and they did a good job, but very, when you squeeze an artery, you can just tell it's an artery because of how, what's the word, elastic it is, I guess. So anyway, this artery right there is subscapular artery. Actually, I don't know what this one is. Oh, they haven't given it its own name. That's interesting. So the subscapular artery has some branches. Now they've put 3 here. I'm used to only seeing 2, so we'll learn this together. Let's see what they called this one. Okay, no, that one. Oh, okay, they're including both of these. That's fine. So there are 2 branches. The scapular circumflex branch, or they've called it the circumflex scapular artery. Either of those are okay. It's going around the neck of the scapula. So that gives you a good hint that it's the scapular circumflex artery. Thoracodorsal artery. Remember there's a thoracodorsal nerve right around here somewhere as well, coming off the posterior cord of the brachial plexus. Let's see if we can find that. That will put us to the test. So here, let's do this. So we need to find the posterior cord first. Okay, radial nerve, which is coming off the posterior cord. So posterior cord's right there. I bet this, moment of truth, I'm nervous. This could either be scapular or thoracodorsal. Oh, we did it. Okay, nice. So that is the thoracodorsal nerve, and it's pretty close to the thoracodorsal artery. There we go. Thoracodorsal artery. They have it going all the way down here. Typically, you see this on the side of the rib cage. You'll see an artery kind of going down near lateral thoracic. Where's lateral thoracic? It's way up here. But thoracodorsal is just a little bit lower. Anyway, sorry, that was kind of a tangent. But so the 2 branches of the subscapular artery are the scapular circumflex branch and the thoracodorsal artery. So that's our S. Now we need our P and our A. So here's the idea. There's two arteries that wrap around the surgical neck of the humerus. One goes anteriorly, one goes posteriorly. And they did a good job. They drew anterior smaller and posterior larger. That is always the case. I maybe seen one or two cadavers where they were the same size, but never the anterior bigger. So anyway, so posterior humeral circumflex artery and anterior humeral circumflex artery, they do it a little bit different than I learned. Again, totally okay. Any of these are acceptable. Anything published in literature like this, I will accept on a quiz. So there's the P and there's the A, and you're going off of which one goes posteriorly and which one goes anteriorly. That's the axillary artery. It's not too bad. So highest thoracic, thoracoacromial trunk with its 4 branches, lateral thoracic, subscapular artery, posterior humeral circumflex, and anterior humeral circumflex. That is the hotel spa. HTLSPA. All right, so we still have a lot more arm. So what's next? After axillary artery, we switch over to the brachial artery. And I think I only have 3 structures for you to cover of this particular artery. The Profunda Brachii, and then we have 2 ulnar collaterals, I believe. So let's see if we can find them. I'm already a little off because I would have expected to see the Profunda Brachii up here. It looks like they drew it way down there. Let's see. Nope. Okay, good. It's not that. Where is the Profunda Brachii? Oh, here we go. Okay, so here it is, Profunda Brachii artery. And you can see they put in Latin Arteria Profunda Brachii. That's how I learned it, Profunda Brachii artery. Deep brachial artery is just as acceptable, if not more so. Anatomical terms are changing. They're trying to get rid of the Latin, and they're trying to get rid of people's names and just keep it simple. But all of us people who learned all the complicated words, we like to hold on. We like to hold on to that jargon. Anyway, deep brachial artery is fine. So that is the first branch of the brachial artery, the Profunda Brachii, or deep brachial artery. And then we have 2 ulnar collaterals. Let's see if we can find them. What's this? Okay, there's superior ulnar collateral. So this is, I'm guessing, no, that's not what we want. Here we go. No. Where is their inferior ulnar collateral? This is too low. Okay, they do it a bit different than what I would say is typical. So let's back up a second. We don't cover these, but typically the Profunda Brachii here has 3 branches. The ascending, the radial, and the middle collateral. They don't have those branches. Oh, they do have middle collateral and radial collateral. I don't see ascending. Anyway, so that's fine. We don't need to cover any of that. What I'm a little perplexed by is that they don't have an inferior ulnar collateral. They're superior. Okay, well, that's fine. I'm certainly not going to teach you something that you can't see on the model. But so after the deep brachial artery, the next branch, they have like these little branches here, but they're lumping that in with the brachial artery. I'm not sure why they do that. It's kind of annoying, but it is true on the brachial artery. There are a lot of little branches that vary a lot from cadaver to cadaver, so they're unnamed, so that's fine. But the first true branch after the Profunda Brachii is the superior ulnar collateral artery. And it meets up with some of these recurrents and things that we're not going to cover. It's called Rimsey-Ripa. It's something that you'll have to learn in more advanced anatomy classes, and it's just it's a way of remembering which branch anastomoses, which means connects basically, with which other branch. So the radial collateral connects to the radial recurrent. That's the Rimsey rip out, R and R. The middle collateral connects to the superior ulnar recurrent. Anyway, you get the idea. We're not going to cover that. I just want you to know the branches of the brachial artery. So we had deep brachial artery here, and then a little bit lower we had superior ulnar collateral. Okay? So deep brachial way up here, superior ulnar collateral way down there. And then here is the brachial artery continuing. The next thing I want you guys to know is it splits. And it splits into two arteries. So here, remember, here's your radius and here's your ulna. So we have a radial artery and an ulnar artery. And we can follow these all the way down, actually. If you've ever checked your pulse at your wrist, this is the artery you're checking, radial artery. And here's the ulnar artery. There's only one branch on the radial artery that you guys are responsible. It's called radial recurrent. It's right there. Radial recurrent artery. It's called recurrent because it turns around and blood flows proximally. So that's called a recurrent. The ulnar artery is a little bit more complicated, so let's dive into it. So again, my first time looking at it, so we'll see if they have all the same structures, but I'm expecting an anterior recurrent and a posterior recurrent. And I can already kind of see them. I'm wondering if you can guess what they are. Because there's one recurrent artery going anterior to this medial condyle and one going posterior. So with any luck, yes, anterior ulnar recurrent artery and oh, there we go, we're okay. Posterior ulnar recurrent artery. So anterior ulnar recurrent and posterior ulnar recurrent. Two recurrent branches coming off the ulnar artery. One's moving anteriorly, one's moving posteriorly. Okay, so this on a quiz is anterior ulnar recurrent artery. This on a quiz is posterior ulnar recurrent artery. And they've done a pretty good job here. This is sort of what it looks like. The branch I typically see much closer to the ulnar artery, but that's fine. And they're drawn pretty small, although in reality they're even smaller than that typically. Okay, so then we have one more structure, and again, a little different than the real, that's okay, it's good. And that is, we're looking for a common interosseous artery, and then we're looking for three branches, and I think we see all three. Let me just double check. Yes, all three are there. So here we go. This is tough. So here's the, let's remove just for a second. This is a nice thing about a computer. We can remove all the nerves. So here is the common interosseous artery. Common interosseous artery. It's called common because it has a posterior interosseous artery and an anterior interosseous artery. And those are great names because one runs posterior to the interosseous membrane and one runs anterior to the interosseous membrane. Let's see if we can add that in. Look at that. So one's a posterior interosseous, one's an anterior interosseous. Again, posterior interosseous artery, anterior interosseous artery. Those are coming off of the common interosseous artery, which is coming off of the ulnar artery. There's one more branch, and it's variable. Sometimes it comes off the common interosseous artery. I would say most typically, I don't know, I can't say for sure, but I've seen it very often coming off the common interosseous artery, but I also do see it, just how they've drawn it, coming off of the posterior interosseous artery. And here it is, the interosseous recurrent, and they call it the recurrent interosseous artery. That's fine. Interosseous recurrent artery or recurrent interosseous artery, those are both acceptable. So there you go. And guys, that's actually it for the upper extremity arteries that we're going to cover. We do not cover the arteries of the hand. You will in graduate anatomy. I mean, depending on time, we may add it, but we still have the leg. We still actually have a lot to do. So, but the hand is very interesting. We have these different arches. We have one that's fed by the ulnar artery and one that's fed by the radial artery. It's pretty cool. But anyway, sorry. So just a quick, super quick run through. So the main thoroughfare is axillary artery, brachial artery, and then it splits into radial and ulnar. So let's go over the branches really quick. See if you can guess them before oh, let's do it like a quiz. What is that? That is the highest thoracic artery or superior thoracic artery. What is this? Just the trunk, not all the branches. That is the thoracoacromial trunk. We have a deltoid branch, an acromial branch, a pectoral branch, and a clavicular branch. Boom. A lot of stuff. If anyone's watching this, if you're in your room studying and they see this, they're going to be like, what the heck are you learning? That is the lateral thoracic artery, so HTL. Subscapular from this angle is not going to be easy. I'm just going to click on it. There's subscapular artery. So now we can go back to our drawing, hopefully. So here is posterior humeral circumflex and anterior humeral circumflex. Based on which one's going posterior and anterior, you can figure that out. Here's deep brachial or profunda brachii. Here is superior ulnar collateral. Someone needs to explain to me where inferior ulnar collateral is. This is bothering me. I think what they did is they just had, yeah, okay. They had the anterior ulnar recurrent going all the way to the brachial artery. That's fine. I'm okay with it. I'll allow it. Anyway, okay, so that was the superior ulnar collateral. So then our next branches, we only have those two branches on brachial. Then our next branches are radial and ulnar. So all we talk about on the radial artery was the radial recurrent. And then we have ulnar. Ulnar had a anterior ulnar recurrent and a posterior ulnar recurrent. And so I remember they had this division like right there, so I should be a little bit more careful there. It's more like a posterior ulnar recurrent and an anterior ulnar recurrent artery. This is just the ulnar artery, continuing. This is the common interosseous artery, which has an anterior interosseous artery and a posterior interosseous artery. And if we flip around, again, posterior interosseous artery, interosseous recurrent artery. Look at that. You guys know the arteries of the upper extremity. That is pretty cool. There's a couple little things, like some of the recurrents and collaterals and hand stuff we didn't cover, but you know 90% now of the arteries of the blood flow of the arm. So I will probably get this posted and see. That was a pretty short run through, so see if we can post some more material. We might jump down into the legs. But let me get this posted for sure with the notes at anponline.com, and just let me know if you have any questions. Thanks.